David Wortley, Vice President of the International Society of Digital Medicine. And the topics that I want to cover today is to talk about what lifestyle medicine is, to give some information about the British Society of Lifestyle Medicine and what their philosophy and their pillars relating to personal health management are. And then I'm going to talk about my experience using consumer digital technologies to manage my own personal health, giving some examples of how technology can be used for moderating your diet, exercise, and mental health. And then finally, I'm going to talk about healthy, active aging and draw some conclusions. So lifestyle medicine, it's described by the British Society of Lifestyle Medicine as evidence-based clinical care. And I like to emphasize the point about being evidence-based. It's not just anecdotal. It's based on genuine clinical evidence, but it's about behavioral change using personalized techniques to improve a range of things, which include mental well-being, social connection, healthy eating, physical activity, sleep, and the minimization of harmful substances and behaviors. And this is all part of something which is a fundamental shift. For most of history, we've been used to the doctor's role as being someone you go to cure a problem. So doctors throughout history have focused on understanding the way the human body works so that they can be there to solve problems for their patients. Today, however, we're in a situation where we have so many lifestyle-related diseases or so-called non-communicable diseases that are threatening the sustainability of public health services. And so it's very important that the doctors also consider preventative health care. And lifestyle medicine is all about life coaching and advising on the factors that people can influence within their own life and their own behaviors. So the three principles of lifestyle medicine, the first of it, very important, is understanding that it's very personal. And it's based on a range of different factors, some of which include the socio-economic factors which determine the health. That is where you live, your income, the kind of relationships you have, whether you're in employment or not. All of these things are factors that can influence your health and your ability to manage your own health. The second pillar is based on techniques which genuinely can make a difference to help people to sustain lifestyle changes. And finally, in the British Society of Lifestyle Medicine, their mission is to improve the knowledge of these 6 pillars of lifestyle medicine. And the 6 pillars are healthy eating. We've already seen a presentation which talks about diet and the potential value of diet in helping to manage conditions like psoriasis, mental well-being, healthy relationships and social contacts, the amount of physical activity and exercise that we have, minimize the use of harmful substances, not just talk about drugs, but also alcohol and nicotine in cigarettes, and finally, sleep. And my own personal experience began back in 2013, but I just want to illustrate some of the issues that we're involved with today, which are a lot to do with the way in which we think about good health and well-being and how we solve clinical problems. And this is my partner's father, who died last year after spending a year with us. And he was 96 years old. Fortunately, he didn't suffer from dementia, so his mind was still active, but he had a range of medical problems that were solved by all the drugs that you see on the left-hand side of the table there. And so this was a real problem is because he had so many different conditions, and some of the drugs didn't necessarily agree with each other. And so the notion that we solve problems by prescribing drugs is not necessarily absolutely correct, because very often because of the nature of our different genetic makeup and the effect of different drugs on our body, you can find that some drugs actually counteract each other. So all of this is a problem, not just for Eric, but also for his carers. And towards the end of his life, when it was obvious that he wasn't going to recover, his drug regime was changed to the smaller number of drugs that you see on the right-hand side of the table. So comorbidity and the idea of prescribing drugs as the main way to solve health problems, I think is fundamentally flawed. And what we need to do now is to transition from this concept of cure into prevention. And prevention is all about behavioral change in our lifestyles. The best chance that we have in increasing our lifespans and improving the quality of our life, particularly in later life, is to adjust our personal behavior and to do so at as an early age as possible. So it starts with children in school, with their education, and a range of other things that we need to address in tackling some of the problems that we face with modern lifestyles. How can technology solve this problem? And how can it influence lifestyle behaviors and circumstances that are at an individual or personal level, but also as a result of influencing the lifestyle behaviors of lots of individual people, we can improve health and well-being at scale in a population? Well, the key factors and influences in health and well-being, primarily, and these are based on my own experience over the last 9 years, diet I would place at the top of the list. For me, I started 9 years ago with focusing on exercise as a way of managing my personal health. But I've learned very quickly that diet is even more important than exercise. But also other things like hydration, making sure we drink enough water during the day, getting sleep and the good quality sleep, the ability to be able to manage our stress and mindfulness. And also, it's very important to recognize that the social circumstances, social and economic circumstances, and the support that you get when you're trying to manage your own personal health, all of these are things that are very important, but all of these things are things that we can have some influence over as our individuals. So looking at the role of technology, the key thing about technology today, and this is why lifestyle medicine, I think, has become into focus, is that because we have the technologies today to be able to measure these key influencers, we have the technology that can measure how much exercise we have. We can have the technology to measure the dietary or the nutritional content of the food that we have. And we can use this data that we get from wearable devices, and I'm holding up one. I have two wearable devices. One is a Fitbit, the other one is a device from China that measure very similar things in slightly different ways. But these technologies allow me to monitor the things that are going to influence my health. And they allow me to create benchmarks for myself. So in my case, one of my primary benchmarks is walking 5 miles every day. And I've walked 5 miles every day for the last 9 years, with very few days that I've missed. But for each individual, we need to set achievable goals, and we need to support that with a framework or an environment which builds in these good habits and makes it easier to comply with a healthy lifestyle. And we can use technology today to also help us with therapies. Digital technologies are used particularly for stress management, meditation, etc. A number of technologies which can help support those activities. And finally, we need to encourage personal responsibility for looking after our own individual health. So these are the kind of the technologies that are available today. The wearable technologies that I've showed you, smartwatches, etc. Smartphones and mobile applications. There's a whole range of these applications now revolving around health, artificial intelligence plays a big role in personalizing the digital lifestyle medicine, because it's able to detect our behaviors and adjust the recommendations based on our individual performances. And none of this would be possible without the kind of 5G broadband connectivity we've got, and technologies like cloud computing, immersive technologies for engaging us and helping us to understand and appreciate the data that is being presented to us. And finally, the concept of gamification as a way of influencing our behavior and motivating good behaviors. So very quickly now, some of the technologies, exercise technologies, we have mobile applications, and these are a range of different mobile applications that I've used over the years. On the left-hand side, this is the very first health and well-being application I used. It was a device called Jawbone Up. It measured my sleep. It measured my physical activity against targets, and also gave me a rating for the quality of the food that I was eating. And this is how I started back in 2013, primarily with the objective of losing weight. And it allowed me to lose 21 kilos in 3 months. So it proved very effective for me. And then there are other devices which have very similar dashboards, but use different kinds of wearable devices. But essentially, they're showing the same kind of things in different formats that are designed to give you some motivation and incentive and reward for achieving your goals. And in my case, this is what happened with me. The pictures on the left-hand side showed what I looked like some 15 to 10 years ago. You can see I was obese, and in May 2013, when I first started, and I won't go into the circumstances, but it was nothing to do with poor health. It was just a curiosity to see what I could do to manage my own health. And so I transitioned from the person that you see on stage in May 2013 to someone whose physique was certainly a lot better only a few months later. So substantial improvements in physical and mental health are achievable, and certain conditions like diabetes too can be reversible through lifestyle medicine. So diet technologies, there are a range of applications which link to wearable devices. This is there is some screenshots from my Fitbit application that show some health parameters, my heart rate, the number of amount of weight I've lost, how much hydration I'm getting, etc. And all of these things are used to give you a calorie target, and by recording what you eat, you're able to not only see what your nutritional content is, but also get some advice on healthy diets. The next generation of diet technologies are based on genetics or epigenetics. So by sending a DNA sample, sending a sample of your sputum, you can link this to a mobile application, which will offer you personalized dietary advice based on your DNA. Now, this is a product called Voodoo, which was designed for elite athletes. So it was designed specifically for athletes who were very keen to achieve optimal performance by being able to manage their weight and their physical characteristics. But it also means that this kind of technology at some point will become available and affordable for the rest of the population, normal citizens. So what we're seeing with the future of digital health is that we will get personalized diet and nutrition based on not only epigenetics, but also medication to avoid this comorbidity challenge. the artificial intelligence and machine learning will recognize in future both the food that we that we purchase. Instead of having to type all of this in, the technology will be able to recognize what is on your plate or what is in the packaging of your food and calculate the nutritional value without you having to record it. I think in future, we also see some of the food delivery services that will be able to offer a personalized service based on intelligence about what kind of diet is good for you. And this will apply both to pre-cooked food and ingredients that are delivered to your door. And the feedback will be linked to biometric data collected from our wearables. So we'll be able to monitor how effective any dietary change is on our personal health. Hydration technologies. This is quite a simple example of a smart water bottle, which it shows you what you're supposed to drink during a day. Something like 1,750 milliliters of water. And this diet bottle with a link to a mobile application will give you a little prompt and a nudge during the day to remind you to take a drink of water. Sleep technologies are improving all of the time. Nearly all modern smartwatch devices measure your sleep and your quality of sleep. The screenshots that you see, the two on the left-hand side come from the Fitbit device, which show me the amount of time I'm asleep and also how much deep sleep I get and how much I'm allowing my body to restore itself. So the right-hand screen is from the other smartwatch that I buy, gives me a sleep score. And again, it breaks down my sleep into deep sleep, awake, light sleep, and rapid eye movement, which is normally when we're dreaming. Stress management technologies, there are a range of devices applications which you can use to not only monitor your stress levels, but also give you exercises on mindfulness and breathing exercises that you can use to set your own benchmarks and understand how you can deal with stress. And in the case of virtual reality technologies, there are quite a number of virtual reality technologies that are designed to create a restful, peaceful environment that will help you to manage your blood pressure and your stress. Social support technologies I mentioned at the beginning. This is all to do with some of the challenges that the older people in our society of loneliness and social isolation. But we have technologies now like Facebook Portal, for example, which allow families to connect together, not only talk to each other, see each other, but have a sense of being more connected than we have been able to do without these kind of technologies. So in my case, I am 73 years old. I've been practicing lifestyle medicine now for 9 years. A lot of it is to do with creating behaviors, good behaviors in your life that become part of your everyday life. So for me, it means going for a walk, normally at about 8 o'clock in the morning. I walk about 4 miles, which is 8,000 steps. And that gets me off to a good start to the day. And I combine this with regular habits which based around diet and the kind of things that I eat. But in order to support older people, the technologies that are developed must be plug and play. It's no good creating something that's complex and requires a skilled person or a young person with an active mind to be able to use. They have to be plug and play, and they also have to combine realistic challenges. It's no good telling somebody in a wheelchair to walk 10,000 steps a day. You've got to give realistic challenges and combine these realistic challenges with fun. So a lot of the games technologies with some of the devices that you use to play exercise games are important in tackling the challenge of a sedentary lifestyle. We also need to engage with family and community. A lot of these applications help us to do that, so that you're not on your own, you're collaborating with other people. And the feedback and diagnostics that we get from mobile devices are important, both for motivating us and also tracking our health and providing the data for lifestyle medicine that validates some of these practices. Because they're all relatively new to the medical profession. And finally, giving users more control over their own health, less reliance on having a doctor to be able to do all these measurements of the data. If we are able to understand the data that we get from our own devices and use it in a positive way, it will give us more own control over our own health. So finally, my last slide, lifestyle medicine is key to preventative healthcare. But behavior change is not trivial. It's complex, and it depends on people's personality and their socioeconomic situations. These digital technologies are developing now. Increasingly, they are medical grade, and they're able to measure our key health influencers, and they will become increasingly affordable, as I say, and medical grade. This is very important if we are to have an equitable health system that is available to everyone. It's not dependent on people's social and economic circumstances. And finally, health and well-being, the technology available today can help create these, what I call digital ecosystems, that effectively facilitate win-win collaboration between health stakeholders. We're seeing this already. In the UK, for example, we have an insurance company called Vitality Life. Now, it's in their interest to have healthy policyholders. So they have an arrangement with Apple where they will provide people who take out a life insurance with Vitality Life. They can get an Apple smartwatch, monitor their physical activity, and if they can prove that they're leading an active lifestyle, they get benefits for their insurance. And employers are also seeing the benefits of giving smartwatches to their employees and encouraging them to adopt healthy behaviours, because it's in their interest to have people who are at work most of the time and not off sick. So for the price of a device, which could cost anywhere between £50 and a couple of £100, they can save substantial amounts of money through lost work or lost productivity from their employees. So thank you very much for taking the time to listen to my presentation. I'm very happy now to take any questions that you